Hey everyone, Dr. Aaron Moreland here from Vallejo Health and Wellness Center in Eden Prairie. And I want to talk to you today about the proper sleep position, because I think I get this question almost from every one of my patients that comes in. It is a question that I ask on my intake form when I'm doing a history, because the reason why is because we spend 6 to 8 hours every day in our bed. That posture can make all the difference in the world. It can be one of the biggest reasons why you're dealing with back and neck pain. And so today I want to show you what that absolute best posture is. And so lots of different ways that we can sleep. There's on our side, there's on our back, and there's on our stomach, and then you got lots of different modifications of each one of those. But I'm going to show you first what some of the postures that I see that can be problematic. And so the first thing I want to show you is a person sleeping on their side. So when we sleep on our side, it's actually probably one of the best postures that we have is to sleep on our sides. But the problem is, a lot of times with people that think they're sleeping on their side really aren't completely on their side. So one of the big ones that I'll see is they'll say that they're on their side, so they'll be like this, but then their pelvis is rotated like this, and a lot of times they have one of their knees up like this, okay? So they're really not on their side. What they're doing is they're sleeping side/stomach. Well, that puts a twist in the pelvis, puts a rotation in the pelvis, and that can create all kinds of low back issues. Again, especially maybe you're in that position for 4 to 5 hours. So that's one of the things that I'll see. Another thing I'll see when they're on their side is they may be perfectly sleeping on their side, but their pillow is too thin, and so their head's kind of sagging like this, or it's too thick and it's being pushed up like this. You really want your neck in a nice neutral posture. So they have these pillows that are really good for, they call them cervical pillows, and what they do is they have a hole for the middle, so if you're lying on your back, it can be helpful, but then it's filled in on the side, so when you roll side to side, it would hold your head up the way it's supposed to. Another thing that we see when people are sleeping on their side is they'll sleep like this, and then they'll put their arms like this. So the problem with that is if I've got my arm like this, it's internally rotating my shoulder, and I'll see all kinds of people come into the office and they're constantly, oh, I got pain in here, doc. And the problem with that can be that because they're sleeping like this, it's creating a muscle that's in here, it's called the subscap, to be super tight, and then it's constantly pulling that shoulder forward, which pulls on this trap and pulls on what we call the rhomboid muscles, and then people get this constant knot back there, but the problem is actually in their armpit because they're sleeping like this. Ideally, when you're sleeping, you want to be holding on to something so that your arms are out like this, so that you're nice and relaxed, so that when you're sleeping, you have a nice neutral position. Okay? Now, for the person that does want to sleep on their back, and back is probably the next best position to sleep in, what you want to realize is your head typically doesn't need a pillow. It's more your neck that needs a pillow. So again, these pillows that have these contours in them can be really helpful. So when I sleep on my back, it's not my head that needs a pillow, it's my neck, so my head's sitting pretty much on the mattress. There's a little bit of a cushion there, but what's happening is I maintain my neck curve. Now, one thing we don't want to do is have our arms up like this. If we have our arms overhead, that constantly pulling on our shoulders, we really want our body in the most neutral posture. So sleeping like this, maybe putting your hands on your stomach like this. I know some people will literally even put their hands in their pajama pockets so that they don't put their hands above their head, because if we do that, that can create all kinds of problems. And you want to have a mattress that really supports the low back, so it's not sinking in, that you lose that low back curve. You're actually maintaining your low back as well. And so you can see that this lying on your back can keep your spine in a nice neutral posture. And then, of course, the worst position we can sleep in is on our stomachs. It's interesting because people come in to see us all the time. We have them lie on their stomachs. Well, one of the reasons why is they're not going to be doing it for very long. We need to be able to see their spine. But the other thing that's not bad compared to sleeping on a bed on your stomach is that we have this groove in here on our tables that allow you to look straight down. Now, if you could do that sleeping on your stomach, that would be much better if you're sleeping with your head straight down. But the problem is, if I'm sleeping and I have to lie on my stomach, my head's going to be cranked either one way or the other way. And that could be an hour at a time, could be 2 hours, could literally be 4 or 5 hours that your head's cranked like that. And when you were younger, you got away with it because your ligaments weren't so tight. But the problem is now, as we get older, that would really cause problems, stretches out those ligaments, can create all kinds of problems. I had a patient that I could easily tell that they sleep on their stomach. And the reason why I could tell that is because their head their neck had major problems with it. And I could tell exactly which way they did turn their head, because they could turn their head this way really good, but when they try to turn their head to the right, this is about as far as they could go, because they're constantly like this all night long, and they don't turn their head to the right. And so they had all kinds of problems, like shoulder checking when they were driving and such. And the reason was because they were sleeping with their on their stomach and sleeping with their head turned. The other thing it does is it really increases the curve of your back, kind of jams these joints when we're sleeping on our stomach. So the problem with that is it can create problems in the back of our spine. So again, that ideal posture then is to really sleep in a neutral position. Side is the best posture. For some people, that's not going to work. Maybe they got shoulder issues, past traumas, maybe their partner is snoring and they need to face away from them, or so they have to sleep on the other side, or maybe they can't sleep on their side anymore, again, because of some of those aches and pains. But that being said, if they can't do that, then the back is the best way, and stomach is the worst position to sleep in. And again, why is this so important? Because we spend 6 to 8 hours every day in our beds, and that can create all kinds of spinal health issues. And so really important that you have the right posture when you're sleeping. Again, this is Dr. Aaron Moreland from Vallejo Health and Wellness Center, and hopefully you're finding these videos helpful. Our goal with these videos is to help people to be as healthy as they possibly can. So if you're finding these videos helpful, please subscribe to our channel. Click on that notification button so you know when we're posting videos. We typically put a couple videos on a week to show you things that you could be doing so that you can be as healthy as you possibly can be. Have a great day, and God bless.